Evening, everybody. So just to let you know that we are recording today's webinar for those who are not able to join us today. This is the webinar on demystifying integration and outbreak response, health and child protection, looking at the successes, challenges and action in Cox's Bazar and DRC. If people want to click through to the Menti link that is pasted in the chat and answer the question about what activities you've been doing in your location or in your work to promote collaboration between health and child protection during infectious disease outbreaks. We'd be really interested to get your views on this. Good morning, good afternoon, good evening, everybody, depending on where you are. This is the webinar on demystifying integration in outbreak responses, looking at the collaboration between health and child protection, and we'll be looking at, more closely at the spotlight on successes, challenges and actions that are happening in Cox's Bazar, Bangladesh and DRC. Let's jump in and we can let people join us as they join the webinar. Can I have the next slide, please, Alison? So first, I just want to explain that we do have simultaneous translation during this session. There's French interpretation, so there's English and French. If you click at the bottom of your Zoom screen, there's a picture of a globe. You click on that globe and you can select your language, English, French, or none. If you speak English and French, you still should click one of those languages, otherwise you might have silent moments. So we do want everyone to click either English or French, otherwise they might have moments where there is no audio. And you can also mute the English audio through this option so that you don't hear two sets of sound. After you've clicked on the globe, there is an additional option at the bottom as is shown on the slide there. So I'll just introduce myself now that you should have English or French translation. My name's Hannah Thompson. I'm a senior child protection consultant who's been working with the Ready Initiative for nearly a year to support and look at and work on the topic of health and child protection collaboration. During the course of today's webinar, there's a few of us who'll be speaking. So we've got Taslima Begum, who's the case management specialist for Save the Children in Cox's Bazar, Bangladesh. We've got Dr. Patrick Libonga Mananga, who's the health cluster co-coordinator for Save the Children in Goma, DRC, Democratic Republic of Congo. We've got Dr. Ayesha Kadir, who's a senior global health advisor for Save the Children. Laura Cardinal, who's the chief of party for the Ready Initiative. Laurie Murray will try and join us, but she's currently in the Ukraine response. She's a senior child protection specialist for Save the Children US. Nidhi Kapur, who's my colleague, working together with me as a senior child protection consultant, supporting Ready on this initiative to look at the collaboration between health and child protection. Next slide, please. Just to quickly run through the outline, we're first starting with these welcoming introductions. If you want to introduce yourselves by putting your name, your job title and your location in the chat and your organization, we'd love to know who has joined us today. We won't have time to go around and ask everyone to introduce themselves. So do put your name, job title, location and your organization in the chat. We will then run through quickly the global findings of research on what health and child protection collaboration during infectious disease outbreaks is looking like at the moment. We'll look at the case of Cox's Bazar and then collaboration in the Democratic Republic of Congo. We'll have some time for questions and answers after the presentations, and then we'll quickly outline next steps. Next slide, please, Alison. At any point, do put any questions in the chat and we'll follow those so that we can come back to them at the end in the questions and answers. So when people are presenting, just put your questions in the chat in the side of the Zoom. So I'll hand over to Laura Cardinal, who's the Chief of Party for READY, to present a bit about the READY initiative.
Hi, thanks so much, Hannah, and thanks everybody for joining the webinar this morning. Before we get started, I just wanted to say a quick word about the READY initiative. READY is a consortium initiative that's funded by the Bureau for Humanitarian Assistance. We are actually ending the first phase of READY this week, and we'll be starting a 2-year second phase of READY next week. And the purpose of READY is really to augment what already exists to help NGOs be better prepared and ready to respond to major infectious disease outbreaks in humanitarian settings, either where there's a humanitarian crisis already ongoing, and then there's an infectious disease outbreak that overlays that humanitarian response, or when the disease itself rises to a humanitarian level. And typically we are working across 3 main areas. The first is to strengthen NGOs' understanding and engagement in outbreak response coordination infrastructure. The second is to support NGOs to have better operational readiness to respond. And the third is to adapt, develop, and disseminate, along with our sectoral working group and cluster partners, technical guidance, and to support technical readiness for outbreak response. Save the Children is READY is led by Save the Children and implemented in partnership with the Johns Hopkins Center for Communication Programs, the Johns Hopkins Center for Humanitarian Health, UK Med, Mercy Malaysia, and Eco Health Alliance. And READY really wanted to highlight the importance of child protection and health actors working together if everybody could mute themselves if they're not speaking, that would be great. One of the things that READY wanted to do was to highlight the importance of how child protection and health actors work better together to meet the needs of children and their caregivers in outbreak settings. We saw during the 2014-2015 West and Central Africa Ebola outbreak that CP actors were not necessarily used to. Hi all, if everybody could mute themselves, that would be great. Thanks so much. We saw during the Ebola outbreaks in 2014 and 2015 that child protection actors were not necessarily used to the significant adaptations that needed to be made to their work to be able to continue critical services for children during an outbreak. Additionally, we saw during COVID-19 that though many children may not have been infected, children were greatly affected by this global pandemic. And we wanted to take learnings from these and other outbreaks to help ensure that we can all be better prepared to respond faster and more effectively in the future for children and their families. So to that end, READY is supporting dialogue between health and child protection actors working in humanitarian settings to identify successes and challenges and recommendations for the way forward. The discussions and workshops that READY has supported are going to be discussed today using the case studies of Bazar and DRC. And these workshops that we have facilitated have led to good discussion, good learnings, and importantly, concrete actions and practical tools for the way forward. So now I'd like to hand over back to Hannah Thompson, our Senior Child Protection Specialist, who will speak and explain in more detail the process READY has used to bring together these 2 sectors. Hannah, back to you.
Thank you for that, Laura. Thank you for that synopsis about the READY initiative. That was very helpful to give the overview. So just as Laura mentioned, now to kind of dive in specifically to the work we've been doing on the collaboration between health and child protection. At the global level, myself and Nidhi Kapur, the consultant I've been working with for the past year, we've been looking at and researching the collaboration between these two sectors and trying to draw on those lessons learned, some of which Laura just highlighted and mentioned. So READY is supporting and trying to enable child protection and health sector collaboration during infectious disease outbreaks. The work is happening in partnership with the Global Child Protection Area of Responsibility, the Global Health Cluster, and the Alliance for Child Protection in Humanitarian Action, with a number of other key actors involved through a steering committee who review all the materials we develop and input on the process as we go through the research and implementation. So it's Nidhi and I working together, and we've carried out stakeholder consultations that included interviews and a desk review. We had 33 key informed interviews, and we've drafted a report that we'll share the link for in the chat now so that you can see the findings of that work. And then we've also been implementing joint workshops between health and child protection actors. We've piloted those, or we've started that process in Cox's Bazar, which started back in August, and in DRC, which started in January. And there at the national level, we're trying to bring the sets of actors together so we can look at what's gone on so far in terms of collaboration, what we can learn, and what we can do moving forward. Next slide, please, Alison. In terms of our global lessons learned based on our desk research, we found that there are constraints related to the time and preparedness needs of working together across sectors in often rapid onset responses. There are issues in terms of knowledge and attitudes, that people don't understand each other's sectors, and they don't necessarily know how to work together, and it doesn't happen consistently. There is an issue in terms of individual versus institutional commitment to integration. So where we have someone who is in post who might be very keen to collaborate across sectors, if they leave, that might not be maintained and continued with a new counterpart. Clusters and the coordination mechanisms that exist in humanitarian response, as well as donor funding, are siloed, which means that each sector stays focused on their own sector. And we've also seen that there are more effective mechanisms often where there are cyclical disease outbreaks, for example, cholera in Yemen, where there's a mechanism for readiness and response, versus a rapid onset new outbreak where those mechanisms might not be in place and therefore some gaps might arise. And as Laura Cardinal highlighted, there's this challenge also with relation to infected versus affected, where often if children are not highly infected and they don't show signs of symptoms, they might be overlooked, and people don't recognize the impact that the outbreak has on them. Next slide, please. So those challenges and lessons learned led us to make some certain recommendations. So one is a need for a stronger theory of change, of how, if you have stronger collaboration between health and child protection, what that might bring to the humanitarian response overall in terms of advantages. The need to clarify roles and responsibilities, what health actors have to do and what it is that child protection actors have to do. The need to embed and integrate child protection considerations into health at the preparedness stage, so that when there is a rapid onset outbreak, we are able to ensure that our actions are taken into account. There are two key entry points that we've identified: risk communication and community engagement, RCCE, and mental health and psychological support. We need to have certain guidance and policies and practice in place. So that includes SOPs, standard operating procedures, referral pathways, and to have an agreed common language so that we understand each other. So health and child protection can speak to each other and know what they mean. And then we need to have team building activities across the sectors so that they are familiar with each other and know each other. Management, budget, job descriptions and guidance all have to allow for integrated activity. And then we need to carry out advocacy with national governments and donors so that they recognise the value, the added value of carrying out integrated collaborative activities. I'm now going to hand over to Ayesha Kadir. Dr. Ayesha has been working with me in supporting Cox's Bazar's workshops and is a real expert as a paediatric doctor on the intersection between health and child protection. Ayesha, over to you.
Thank you, Hannah. And it's really great to be here today. And yeah, I would like to just ask if we can advance to the next slide. And what I'm going to talk a little bit about are the reasons why the health sector and the child protection sector, sorry, just getting my camera on for you, should be collaborating. I think this really shouldn't be so much as a opt-in, nice to do, but actually it's critical if we want to be able to work in effectively in health or in protection. We've got to work together. So I'll just simply talk about a few of the reasons why, and there are many more, and in quite a bit more detail we could potentially speak about in the future. And I'm also happy to share links to resources if that is useful. So health and protection have intersectional impacts on each other. And what this means is that the health of children and the health needs and risks of children impact their circumstances around their safety and what kinds of risks, protection risks they will face. And in turn, their safety and protection risks and protection incidents have really important impacts on health. The obvious ones are, of course, injury, illness, whether this is related to being attacked or assaulted in the home or outside, or potentially, for example, with sexual assault and illness. There are also many other ways in which children can become ill because of protection issues. So labor, if they're working, labor conditions, or early marriage, and so on. An important one that is very difficult to measure in humanitarian context, and especially in outbreak contexts, but which is critical to everything that will happen to that child going on in their life, is something called toxic stress. It's where basically the adversity, the negative things that happen in a child's life, whether it's armed conflict or forced displacement or an infectious disease outbreak, which then makes them stay home from school and basically turns life upside down, alters their safety again. Any kinds of protection concerns are effectively toxic stress. These are cumulative and they change the way children's bodies develop and they change the way their brains develop. And so who they become and what kinds of health risks they will have are directly impacted, and this affects everything that will happen to them, every opportunity they will have in their life, and all the risks, the protection risks that follow up from that. So they're immediate and long-term impacts. In looking the other way, how does health impact child protection? Children are actually, especially children who have protection risks, they are often difficult to get sight of. They may be out, they may not be reaching, they may not be in school. They're less likely to seek social or protection services. So they are likely to have health issues that will then, it may be directly from their protection risk or incident, or it may be unrelated. But anytime we have a child coming into a health facility or meeting a community health worker is an opportunity to screen them, to recognize when there's a protection risk. And using health language is a really sort of a non-Latin, what's the word? It's something that's a more acceptable way for people to, it's much less threatening, non-threatening is what I was looking for, way to engage communities to talk about things like violence, violence against children, sexual violence against children, especially gender-based violence, and other forms of protection. Next slide, please. So really quickly, what are the benefits that we can sum up? Collaboration between health and protection helps us to identify children who have protection risks, figure out how to prevent, so mitigate those risks, and thereby also protect their health and their safety. And to rapidly identify and respond to when something does happen, get them access to life-saving medical treatment and access also to other public health services that will promote healthy, normal child development. So health and protection really play critical, interrelated roles to ensure that safety and the well-being of children. And this is particularly important in humanitarian context, and especially in a compounded humanitarian context where an outbreak has occurred. Thank you so much. I will hand back to Hannah.
Thank you, Dr. Ayesha. That was really interesting. As I mentioned earlier, if anyone has any questions, please feel free to put those in the chat and we can come back to Dr. Ayesha at the end. We've got a little slot at the end to address questions. I'm now going to hand over to Taslima. Taslima Begum, as I mentioned at the beginning, is a child protection specialist looking at case management in Cox's Bazar in Bangladesh. Over to you, Taslima. And if there are any questions for Taslima as well, just put those in the chat so that she can answer those at the end. Thank you.
Hello, everyone. Good evening from Bangladesh. This is Taslima, as Hannah mentioned. So today I would like to talk about our experiences of collaboration between health and child protection sector during the COVID pandemic. So the Bangladesh government declared a nationwide lockdown in March 2020, and given the population density, the Rohingya refugee camps were deemed a high-risk area. So the government restricted the movement of humanitarian workers to the camp and also reduced the availability of services. Initially, child protection wasn't thought to be a life-saving services, and the child protection actors faced challenges to access the camp in a regular basis. So at that time, CPSS took a number of initiatives to identify and address the child protection concerns during the pandemic. And the collaboration with the different sectors was one of the strategies. So today here, I would like to share the initiatives which CPSS took for increasing our collaboration with the health sector. Next slide, please. Yeah, here are the initiatives we have taken. So firstly, at the very beginning of the pandemic, CPSS formed a working group to work closely with the health sector. So the child protection actors was the member of this working group, and they are UNHCR, UNICEF, Relief International, Save the Children Plan International, BRAC, CODEC, and IOM. So this Save the Children was the co-lead of this working group, and this working group developed different guidelines, worked on capacity building of child protection and health sectors, and also maintained a regular coordination with the health sector and health actors. So the working group developed a guideline for the health sector, focusing on addressing child protection issues related to the pandemics at the healthcare center. So the guideline was developed by the working group, and later it was finalized, incorporating the feedback from the health sector as well. And then another initiative was having child carer at the treatment center. So the child carer are the mostly health staff, and they were nominated by the health center. Then they received a day-long training, which was facilitated by the child protection subsector, and the health sector provided the logistic support. So the training was focused on communication with the children, identifying the child protection concerns, and the referral process, and roles and responsibilities of the child carer, and how child carer can conduct PSS activities with the children, and also the self-care. So later in 2021, we adopted this training package, a day-long training package for conducting virtually. And then we also introduced child protection volunteer for the quarantine center. So the child protection volunteers are the regular CP volunteers who are the community based, and they were identified the child protection actors. And they have been oriented by the child protection actors on their roles and responsibilities. So the working group developed roles and responsibilities, and later it was translated in Burmese and Bangla. Also, this working group maintained regular coordination with the health sector and the health agencies, and especially we experienced a very good experience, a good relationship in terms of referral relationship. So as an example, like if a caregiver is admitted to the treatment center, COVID treatment center, leaving their children behind at the community without appropriate care. So the health sector informed the CP actors, and CP actors worked on supporting the communities to identify a preferred caregivers and alternative care option for those children. And also the child protection actors proactively worked on support the child if they left ITC without completing that treatment. And then child protection actors also presented and worked on the verification and unification process of the unaccompanied and separated children during discharge from the hospital. This working group also developed a guidance for the child protection case workers on how to work with the children in quarantine center or isolation center or inpatient facilities. Next slide, please. Yeah, so this is the screenshot of the guidelines which we developed for the health sector, focusing on care for the children at the health center during the pandemic. So the guideline, it includes the key terminologies, principle of working with the children, and there was a scenario-based explanation for the quarantine center, isolation unit, and SARI ITC center, and also discharging protocol. And another screenshot is the roles and responsibilities of the child protection volunteers. So this is the translated one in Bangla. Next slide, please. Yeah, so under the READY initiative, 3 workshops took place at Cox's Bazar. The first workshop was virtual, and it was focused on identifying and tracking the current practices, the challenges, and what's going well, what's not. So yeah, and then the second workshop was the face-to-face workshop, which was focused on identifying the key actions for strengthening the existing collaboration between child protection and health. And then the third workshop, which was also virtual, and it was for identifying the key technical content for us. Next slide, please. Yeah, here the key findings for the second workshop, which was face-to-face. So as I said, the workshop was focusing on identifying the key actions, actually what we have to do for maintaining and strengthening our collaboration with health sector. So from the group work, it was identified that we need a regular coordination at the sector level, at the actors level, and also at the field level. And the participants of the workshop talked about having a common working groups and also having a regular periodical coordination meeting in between child protection and health. And then the capacity enhancement activities also were identified a key action for us, which includes capacity assessment, training for the mid-level and field-level staffs, also for the volunteers, and continuous follow-up after providing a training. And then having a dedicated focal point from both sides, child protection and health, especially at the field level, and also conducting the service mapping, develop the referral pathway, and information sharing about the referral pathway, especially at the field level. And then the participants talk about a lot about the joint initiatives for sensitize the camp administration, the volunteers, and also the community engagement, developing IEC. So like they were focused, these activities should be done by both sectors together. And then they were talked about like identifying the common principles and developing a common guideline, and also include the importance of collaboration and the activities in the joint need assessment and also in the GRP. So actually what resource we need for implementing those actions. So yes, we need a guideline or SOP and common online platform for accessing the information, regular coordination meeting, dedicated time and human resource, volunteers and dedicated budget, technical expertise for implementing those, and also availability of IC materials, common reporting format, and also a field level focal point and TOT for the sectoral focal point. Next slide, please. Yeah. So from the third workshop, we have identified the key deliverables for ready for the health and child protection collaboration in Cox's Bazar. So we are now working on 4 key deliverables, which are a visual referral pathway. So you can see a picture of a visual referral pathway, which was developed by the ready. And then also we are working on a tip sheet for making our health center child friendly, and a tip sheet for recognizing child protection concerns in the health center, and also a confidentiality guidance note for guiding us, like when we collaborate with child protection and health, how we can maintain the confidentiality of our beneficiary. So yeah, that's all from my side. Thank you all for listening to me.
Thank you so much, Taslima. That was really interesting, and I'm sure it raised a lot of questions and thoughts and interest from participants. I'll now pass over to Dr. Patrick and Nidhi Kapur, who will facilitate. Sorry, Patrick. Dr. Patrick, do you want to go ahead? Dr. Patrick, est-ce que vous voulez commencer votre présentation? Nidhi, do you want to step in? Given we don't have Dr. Patrick, maybe his connection's dropped out.
En fait, I see Dr. Patrick is there and is off mute, but there might be a technical problem because we can't hear him. Dr. Patrick, est-ce que vous pouvez essayer de vous faire, de relancer le mute ou bien, yeah. Oh, Dr. Patrick, we still can't hear you, unfortunately. Perhaps try unplugging your headphones and trying, because it was working earlier. Okay, you can hear us, but we're not able to hear you. On peut pas vous capter, en fait. Peut-être que vous pouvez essayer de débrancher vos écouteurs.
Je ne sais pas. Moi, je suis là.
Voilà.
Ça marche?
Oui, ça marche maintenant. Parfait.
Ah, d'accord. Désolé. Peut-être ce sont les écouteurs qui dérangeaient. Alors, merci pour la parole. Merci, chers partenaires. Merci à ceux qui m'ont précédé dans la présentation. Je vais essayer aussi de partager un peu l'expérience de la République démocratique du Congo par rapport à comment nous pouvons renforcer et démystifier la collaboration entre protection et santé lors de flambées d'épidémie. Et comme vous savez, la RDC, c'est un des grands pays de l'Afrique centrale, avec une superficie de plus de 2 345 400 km², avec plus de 8 millions d'habitants estimés. Et c'est un pays qui compte 26 provinces avec 519 zones de santé. Et la zone nord-est que nous coordonnons compte 5 provinces entre autres le Nord Kivu, l'Ituri, et ce sont les deux provinces sous état de siège pour des raisons sécuritaires, comme vous le savez. Et dans le secteur de la santé, le pays surveille plus de 20 maladies sous surveillance. Et parmi ces maladies, il y a des épidémies de grande envergure comme la maladie à virus Ebola et ainsi que la COVID-19. Et parlons de la maladie à virus Ebola, DIA, s'il vous plaît, la RDC est à sa 13e épidémie, expérience d'épidémie de la MVE. Et comme vous le savez, depuis 1976 à 2021, ce pays a connu 13 épidémies de la MVE et ces épidémies ont eu des conséquences sur les enfants. La dernière, d'ailleurs, a vu aussi la majeure partie des personnes affectées, c'était les enfants. Next dias, please. Alors, je parle de la province du Nord Kivu, qui, elle aussi, est à sa 3e expérience. La province du Nord Kivu est à sa 3e expérience de la maladie à virus Ebola. En 3 ans, depuis 2018 jusqu'à 2021, la province du Nord Kivu a connu 3 épidémies d'Ebola. Et au-delà de ça, vous pouvez voir le résumé du contexte de la RDC, tel que c'est affiché là-bas. Merci de fermer le micro, s'il vous plaît. Mapendo, merci de fermer le micro, s'il vous plaît. Donc, en dehors du contexte d'épidémie, vous pouvez voir qu'il y a d'autres maladies et épidémies comme le choléra, la peste en Ituri. Vous pouvez voir l'éruption volcanique de l'année dernière que nous avons vécu, de tristes mémoires. Et dans un contexte de conflit, avec des mouvements de population importants que vous pouvez remarquer. Diapo, s'il vous plaît. Et vous comprendrez que c'est dans ce contexte-là, next dias, please, c'est dans ce contexte-là que interviennent les différents acteurs humanitaires. Et ça, c'est une carte qui représente la présence humanitaire des acteurs dans le secteur de la santé. Et évidemment, nous intervenons toujours aussi en collaboration avec certains acteurs en protection. C'est surtout la protection de l'enfant parce que nous avons des thématiques très rapprochées comme les violences basées sur le genre, la santé mentale, le soutien psychosocial. Et nous organisons des étroites collaborations, le lien d'étroite collaboration avec le sous-cluster VBG qui aussi interviennent dans le secteur de la protection et précisément la protection des enfants. Diapo, s'il vous plaît. Donc, vous comprendrez que toutes les 26 provinces sont affectées par la COVID-19. Et parlons de la COVID-19, la RDC occupe la 17e place en termes de nombre de cas. Next dia, please. La 17e position au niveau africain en termes de nombre de cas et 27e position en termes de la létalité, c'est-à-dire le taux de décès. Donc, vous comprenez que cette dia montre réellement comment la COVID, la MVE a sévi la RDC depuis son apparition en 1978 et jusqu'en 2022. La dernière épidémie, la 13e, a été déclarée, la fin a été déclarée le 16 décembre dernier. Donc, vous pouvez voir que la zone orange foncé, ça représente la région du Kivu et c'est là où il y a un peu plus de cas ou un foyer de la maladie à virus Ebola. Et comme je l'ai dit, les enfants sont souvent les victimes de cette épidémie. Next dia, please. Et vous pouvez documenter, on va vous partager la présentation avec tous les détails et ça vous permet d'avoir une idée. Et c'est dans ce contexte-là qu'au mois de janvier dernier, nous avons été approchés par Nidhi, que je remercie beaucoup ici, où nous avons organisé des ateliers hybrides en ligne et en présentiel le 11 février ainsi que le 22 février. Le 11 février, ça a mis l'accent sur l'importance de la collaboration entre le secteur de la santé et la protection de l'enfance pendant les épidémies. Et on a mis l'emphase sur la maladie à virus Ebola, MVE, et la COVID-19. Et dans ces échanges-là, les partenaires ont montré vraiment l'importance de renforcer cette collaboration parce qu'en dehors de tout ce qui a été enregistré comme force, il y a eu quand même pas mal de de faiblesse qui nécessitent à ce que les mécanismes de coordination et de collaboration et partenariat soient renforcés. Voilà pourquoi nous avons tenu cet atelier et vous pouvez voir là les participants à cet atelier et ça, les intervenants ont émis beaucoup de réactions sur des contributions très pertinentes que nous allons vous partager dans le lien pour pouvoir comprendre comment la dynamique de collaboration et même les suggestions sur les défis à relever ont été gérées et proposées par le partenaire. Et pour le deuxième atelier du 22 février, nous avons bénéficié d'un renforcement technique sur les 5 actions critiques d'intégration associées aux aspects liés à la prévention de l'exploitation bisexuelle. Next dia, please. Et c'était aussi des occasions de formuler des échanges sur ces 5 actions critiques qui sont nécessaires que nous devons mener, notamment la prévention de la séparation des familles en raison de mesures de santé publique et promotion de l'unité familiale pendant l'admission, pendant les soins et à la sortie. Parce qu'il s'est observé vraiment qu'il y a eu des soucis. Les enfants ne sont pas, surtout ceux qui sont en séparation familiale, ne sont pas bien pris en charge et gérés pendant les périodes de flambée d'épidémie. Et il était aussi question de pouvoir mobiliser, mettre en place un protocole pour identifier, documenter. Merci de fermer le micro, s'il vous plaît. Il était question de pouvoir mettre en place les protocoles pour identifier, documenter et référer les cas de protection de l'enfant, surtout par les agents de santé, et aussi renforcer la communication des risques et engagements communautaires. Le volet communication est très important, c'est pourquoi il faut mettre en place des messages clés qui soient adaptés aux enfants. Parfois, on a tendance à penser que oui, j'utilise la radio, nous faisons des sensibilisations à la radio et que les enfants sont censés suivre. Non. Ou bien nous passons le message des émissions à la télé et que les enfants sont censés suivre. Non. Il faudrait vraiment adapter le message et les canaux de communication par rapport aux besoins des enfants. Et nous avons pensé que c'était utile de mener une telle action aussi. Mais, quatrième action critique, nous avons pensé aussi qu'il faut qu'il y ait des mesures adaptées pour les enfants dans les centres de traitement en matière de nutrition, de récréation, d'éducation. Parce que nous sommes dans un contexte un peu plus compliqué sur un fond de pauvreté, un fond de crise, de conflits, mais aussi il y a des aspects liés aux besoins de santé et de protection des enfants qui s'ajoutent. Alors, dans ce contexte-là, il est important de mettre en place des mesures adaptées dans les centres de traitement, les centres de prise en charge, et faciliter l'alimentation de l'enfant qui soit équilibrée, qui soit adaptée, parce que pendant les périodes d'épidémie, on n'a même pas la possibilité d'avoir accès à un régime ou à une alimentation équilibrée à 5 étoiles. C'est pourquoi il est important de mettre en place ça. Et les activités récréatives, généralement, et éducatives sont mises de côté pendant les périodes d'épidémie. C'est pourquoi il est important, ça contribue à la santé des enfants, surtout que le fond de la crise est soit sanitaire ou soit sécuritaire. Les enfants assistent à des mamans qui sont tuées, leurs propres frères et d'autres gens, et qui ont une répercussion mentale sur eux. D'où il faut penser aussi à ces activités-là pour compléter. Mais aussi les programmes de vaccination et de dépistage qui soient adaptés aux enfants. Effectivement, dans le contexte de la COVID-19, actuellement, next dia please, la vaccination n'a pas encore bénéficié d'une emphase comme telle chez les enfants, mais il est important déjà de commencer à réfléchir pour le moment et penser aux prochaines étapes, parce que dans l'avenir, je pense qu'on pourra aussi développer les vaccins adaptés aux enfants dans le contexte d'épidémie. D'où l'intérêt de s'y pencher déjà et de mettre en place des choses. Alors, pour les prochaines étapes, le next step, nous devons développer et disséminer les outils adaptés au contexte de la RDC et des enfants. Et ces outils-là doivent être traduits en français, en Swahili et en Kinyarwanda. Les 3 langues-là sont les langues qui sont un peu le plus utilisées, et nous pensons que si on traduit ces outils qui parlent des conseils sur les campagnes de vaccination chez les enfants et les pères, par exemple, un checklist, liste de contrôle pour rendre un peu les centres d'isolement, de mise en quarantaine beaucoup plus attrayants et actifs pour les enfants et pour leur prise en charge, mais aussi on peut mettre en place des structures et les cadres de collaboration. Ça, c'est parmi même les objectifs de REDI entre les acteurs en santé et en protection pour faciliter les évaluations, les analyses et les réponses conjointes spécifiques aux besoins des enfants. Et surtout pendant les périodes d'épidémie, souvent ces besoins spécifiques sont mis de côté. Et enfin, nous avons pensé qu'on pouvait initier déjà un groupe WhatsApp des acteurs en santé et protection, en commençant par ceux qui ont participé à ces 2 ateliers et étendre ça au fur et à mesure à tous ceux qui manifestent l'intérêt pour cela. C'est vraiment l'occasion de remercier Reddy et me remercier Nidhi et toute l'équipe, Anna et lui, Dr Babou, tous ceux qui ont contribué pour que ces 2 ateliers au Nord Kivu à Goma puissent avoir lieu et les recommandations pertinentes soient formulées. Merci beaucoup et je reste disponible s'il y aura des préoccupations.
Thank you so much. Thank you so much, Dr. Patrick, and to all of our speakers. I'm Nidhi Kapur. I'm happy to join with you today, all of you. And happy to see so many familiar faces in the audience as well. This is our time now. We have maybe 5 to 10 minutes for questions and answers. We already had our first question from Munawar. I'm sorry if I'm pronouncing that incorrectly. For Dr. Ayesha, but just an invitation to everyone. If you have questions for our speakers, please do post them in the chat, and we'll hopefully have an opportunity to get to them. So first of all, maybe I can pass to Dr. Ayesha. We had a question in the chat earlier asking whether in most emergency contexts, we know that health is implemented separately from child protection. Is there a global toolkit developed to ensure mainstreaming of child protection with health, especially in emergency contexts? So the question was posed to Dr. Ayesha. I'll let her respond and maybe we can help complete as well. Thank you, Dr. Ayesha.
Yeah, and thank you, Munawar, for bringing this up, because this is a really important need. So the short answer is no. There is not a global toolkit. However, there are quite a few examples of the way child protection has been integrated into.
Is everyone else hearing Dr. Ayesha? Is it?
Oh, sorry. Are you able to hear me, Hannah?
I'm able to hear you fine, Dr. Ayesha. Yeah, I think go ahead.
Okay. And I think there's some background noise, actually. I can hear somebody else. I'm not sure where that was coming from, but yeah, there is a huge need.
Oh, sorry, one second, Dr. Ayesha. Apparently multiple people can't hear you.
Yeah, I'm not able to hear Ayesha, but it sounds like you can, Nidhi. Are you able to say
yes,
what
I
she
can. Was saying? I'm just wondering if we need to switch. Dr. Ayesha, are you in the English channel?
That's fine. So we just turn it off.
I'm actually,
okay.
I think I'm in the main channel. Yeah.
Okay, could you put yourself in the English channel? And we can hear from some participants who said that they can hear you. Okay, so please go ahead. Sorry for the interruption.
Okay, all right. Yeah, so I am, yeah, I'll start over again. You know, this is a really important need. The short answer for that is no, there is not a global toolkit. However, I think it's fair to, I mean, also in line with what some of the other speakers have mentioned. I think it's the way there are a few things that we can do, like Dr. Patrick was mentioning about keeping the children in focus and then adapting what child protection and integrated activities should be tailored to the needs of the children. And this is really important to adapt to context. So while it can be useful, and hopefully maybe we can work together to develop a global toolkit for like a blueprint for some areas where child protection can be mainstreamed in health, and where health can be mainstreamed into child protection. It has to go both ways. But if we can, if we were to do that, then I think we would need to make sure that it is sufficiently sort of a structure that is sufficient for people to then adapt. I can share with you a few examples of the way that child protection and health have been integrated in specific responses, if that is useful. I'll stop here, and Nidhi and Hannah, let me know. I can share with you, and you can distribute further if that's of use. Over.
Great, thank you so much. Just to add on to what Dr. Ayesha was saying, Hannah and I have actually been working on behalf of the Alliance for Child Protection in Humanitarian Action, again with the support of the READY initiative as well, to develop updated guidance for child protection in infectious disease outbreaks. And so in response to the consultations we've done with field practitioners, that new guidance is being produced in the format of mini guides. So about 10-page documents that are a lot more practical and oriented towards people working in the field. And one of those mini guides is specifically looking at the intersections between child protection and the health sector. And so that should be released actually within the next 1 month, and will be available in multiple languages on the Alliance website, as well as the Save the Children Resource Center. So look out for that, and hopefully our colleagues at READY can help to circulate that amongst the webinar participants as well when they're ready to be released. So we have maybe time for 1 or 2 more questions. I'd like to ask Taslima if you could tell us a little bit more about how the relationship between the child protection and health sectors have changed since COVID started in Cox's Bazar. Could you describe a little bit more how you think that relationship between actors of the both sectors has really changed throughout the course of the pandemic? So I'll pass over to Taslima, please.
Thanks, Nidhi. So yeah, actually, from our experiences, we found that due to the initiatives we have taken during COVID, it increased lots communicate with other, to collaborate each other, and also to be in touch with each other. So before that, we didn't have that joint workshop, joint training for health sector, which was arranged by the child protection, or we didn't have that frequent coordination. So for the 2 years, we worked very closely, which we didn't before that COVID. So and now we have a very spontaneous relationship with the health sector at the field level and also at the sector level, which we didn't have before the pandemic.
Great, thank you so much, Taslima. And we'd also like to know from Dr. Patrick, what do you foresee as the next steps for collaboration between the child protection and health sectors in DRC? What kinds of activities do you see the 2 sectors taking forward in outbreak settings in the future? So I'll pass to Dr. Patrick.
Oui, en fait, merci pour la parole. Ça, c'est une très bonne préoccupation. Je pense que, comme nous l'avons souligné, d'abord, il faudrait que nous puissions mettre en place les outils. Et ces outils-là doivent être des outils adaptés au contexte de l'enfant pour essayer de voir comment, lorsqu'il est question, par exemple, de vaccination, comment se prendre et qui tient en compte les besoins spécifiques des enfants. Et que aussi, même lorsqu'il est question de comment renforcer la collaboration et comment intervenir de manière prompte. Et dans ce cas-là, ça va demander à ce que, déjà, pendant cette période où, par exemple, on n'a pas l'épidémie de la MVE, on doit être à mesure de mettre déjà en place quelque chose comme un plan de contingence qui intègre de manière spécifique le besoin de l'enfant, de manière à ce que si puisqu'on est dans une zone potentiellement épidémique, si une épidémie s'est déclenchée maintenant, comme la MVE, même si on est déjà dans la COVID, mais comme la MVE, il faut qu'on sache qu'est-ce qu'il faut faire entre acteurs protection et acteurs santé pour essayer de permettre à ce que les besoins des enfants qui sont les plus vulnérables puissent être rencontrés. Dans ce cas, il est important de pouvoir aussi préparer, renforcer les capacités des acteurs, faire en sorte que le staff, les équipes qui vont intervenir aient des capacités, aient des connaissances, que ce soit en matière de santé, en matière de protection de l'enfant, et aussi les ressources puissent être disponibles et mobilisées afin de permettre à ce que la réponse soit appropriée et adaptée. Mais aussi, et enfin, il sera intéressant aussi que le cadre de collaboration, le cadre de coordination, de renforcement, des échanges et d'expériences soient mis en place pour que les alertes sur les épidémies soient partagées, les expériences sur ce que font les autres ailleurs puissent aussi être partagées et qu'on essaie de les adapter au contexte de la RDC. Et tout cela mis ensemble, il serait important aussi de renforcer l'approche de partenariat avec le ministère de la Santé, le ministère qui s'occupe de la protection, la division des affaires sociales, genre et protection des enfants, et aussi les partenaires clés comme l'UNICEF, tous les partenaires qui ont un intérêt particulier et une attention focalisée sur le besoin des enfants. Merci beaucoup.
Thank you, Dr. Patrick, for that response. I see we only have 2 minutes left, so I'm going to unfortunately have to close the questions and answers and pass on to our Chief of Party for Ready, Laura Cardinal. Please go ahead, Laura.
Thanks so much, Nidhi, and thanks everybody for the great presentations and the really thoughtful questions. I know that I learned a lot just listening to all the great presentations and hearing the great responses. So in terms of next steps, I wanted to let you all know that Ready will be extended for another 2 years, and we will be potentially looking to do more of the integration workshops at the country office or subnational level with interested countries. So if you are interested, please do reach out to Lori Murray to let her know. And then as we develop our work plan for this next phase of Ready, we will reach out to you to explore options of how we can work together to continue to build on the great lessons and learnings from the Cox's Bazar and DRC workshops. I want to thank all of the speakers and presenters, and I also want to thank Allison for stepping in at the last minute to support the webinar. As Hannah mentioned, Lori is deployed to the Ukraine response right now and wasn't able to join. And I also want to thank Laura Romig for all of her support in the background, for getting us organized and making sure this was a smooth process. And of course, to Beatrice, our wonderful translator from JR Solutions. Beatrice, I sort of feel like you're part of the Ready team at this point. Please do go to the Ready website at readyinitiative.org for additional information about the Ready Initiative and to find some of the resources that were referenced today. We will also be sending through to everybody that participated the slides that were shared today, as well as the audio recording of the webinar. And then later, in about a day's time, you'll also be able to find the webinar and the resources on the website as well. If you're interested not only in these workshops or any other work that Ready is doing, or if you have ideas of gaps that currently exist in NGO readiness for national or international NGOs for outbreak response that you want us to know about, or you want Ready to focus on in its second phase, please do reach out to us at ready@savechildren.org to share your ideas, where we would really welcome those discussions. So thank you all so much for joining us today, and have a great evening, afternoon, or morning, depending on where you are. Thanks so much, and have a great day.